Hi everyone, and welcome to the GuideWell UST Global Innovation Center here in Lake Nona. My name is Kate Warnock, and I have with us today Charlie Joseph. Charlie, welcome to the interview.
Thank you, Kate. It's nice to be here and spend the time with you.
Oh, happy to have you. So Charlie is a Senior Vice President and General Counsel for GuideWell. You know, Charlie, as General Counsel for GuideWell, as we just mentioned, and from a health policy standpoint, how is it that you see we can help improve the cancer patient experience?
Sure. I think that access to affordable, quality health care is really foundational to the patient experience. And with respect to healthcare policy, I think those three core principles around access and affordability and quality really have to be kept top of mind for everything that we do as we consider legislation, as we consider the regulatory environment as well. But it's beyond that, too. Those things are foundational, but I think there are a number of other things that are very important as well. Maybe just to touch briefly on a few of them. One, I think, is the importance of access to information as well. So this is, needless to say, a very stressful time for people, and so giving patients and their families access to real-time, relevant, easily understood information to facilitate informed decision-making, I think, is absolutely critical as well. That's one thing that I would say. In addition to that, we're making great strides with respect to research in this area as well. So continuing to enable really great research to occur is important, I think, and I think with respect to that, the funding component, incentivizing appropriate research is key as well. And then the third thing that I would mention here is just really around system navigation here. It's, again, a stressful time for patients and their families, and all too often the system is overly complex, it's overly burdensome, it's difficult to know where to go. So I think having effective collaboration among the providers is important, but making it as easy and as simple as possible is important as well. So I would just submit that as we're thinking about healthcare policy, it's the three items that I mentioned and the other three that are really important too.
You know, and I think it's important you draw such attention to the role that government really can play in being a force for good, in helping to simplify those medical records, for example, and making sure that data information is shared in a way that the consumer can understand it. You don't need a PhD to read through your results or that sort of thing. So it's a good reminder that, we really, it is about partnership and collaboration. Yeah. Yeah, so, well, Charlie, another thing that I wanted to share with our audience is the fact that you are also a two-time cancer survivor. And we're so fortunate that you have your health and that you're here with us in your leadership role at GuideWell. You know, I wanted to have you describe your own patient experience for us.
Well, thank you for the question. That is true. So I was initially diagnosed with an early stage melanoma when I was 30 years old. And at 30 years old, you don't anticipate hearing that kind of information. And it's pretty shocking when you hear it. And it was at an interesting stage of my life. My wife and I, our first daughter had just been born a couple of days earlier. So it's an extraordinarily magical time in your life, needless to say, as your firstborn child, when you have your firstborn child. But a couple of days later, you hear this other information that makes you really begin to think about what's most important in life and your family. So it was just this wonderful high tempered by this other news, and you work through it here. I was very fortunate that I had great care, and the treatment protocol was relatively straightforward. So a very good patient experience with respect to that diagnosis. What was a little bit trickier, 21 years after that, I guess it was, I was diagnosed with prostate cancer. Unlike a number of cancers where the treatment protocol is fairly straightforward with respect to prostate cancer, there are several different options that you have. And so I was very fortunate to have two outstanding healthcare providers, a urologist and also a radiation oncologist. And my takeaway with respect to the urologist in particular was the information that he shared and his willingness to be very, very candid, which I thought was important. And when I heard the diagnosis at first, it's difficult to think of the questions. And we probably spent 10 or 15 minutes just talking. And I thought he was really great. And he suggested that, he said, come back in a week. Bring your wife at that point, give some more thought to your questions here, and I will be here for you, and I will give you candid responses to anything that you want to ask. And we'll go through the pluses and minuses of the various treatment options. And so we did, and he was really, really great. And it made me feel like I could make a very informed decision when presented with these these different options. So I thought the information sharing, like I said at the outset, is really, really key. That was an important takeaway for me. And the other thing that I would mention is with respect to the radiation oncologists, we spent a lot of time talking this morning about the importance of treating the patient as a whole person here, and really going beyond the notion of the scientific aspect of going for the cure, but really focusing as well on the healing component as well. And so I think that my experience with the radiation oncologist and his office and his staff reflected that, and they were caring and they were nurturing and they were respectful of my time as I came in, and it was in and out in 20 minutes, but you really got to know the staff, and they really demonstrated, I thought, a true concern for me as an individual here, which I thought was important. So the notion of treating patients with respect and dignity, I think, is also really key. So again, have only positive things to say about my experiences as I went through it here, but I think the information component and then being treated with that respect and dignity made the experience an overall positive one and an enlightening one in a lot of respects as well.
Well, I'm so glad to hear that you did have that kind of experience, and fortunately a healthy outcome from both of those events. So, so if we can elevate above, everything that you just shared with us, the health policy perspective on better cancer care, your own experience and what your takeaway was and what you think is foundational. Can you share with us, what do you see, what has you most hopeful about the future of cancer care?
That's a great question, Kate. I guess I would say a couple of things in that respect. First of all, I think we've really made some great progress in this area. And when you think about where we were only 10 or 15 years ago, the outcomes are much, much better right now. So I think we've made some great progress here. And cancers that were not particularly treatable and the survivorship rates were very low, a lot of that is changing now for the better, and the survivorship rates are much higher with respect to a number of different cancers. So I think we need to make great progress. I had a grandmother who passed away when I was 10 years old, and she died of breast cancer. And my mother, her daughter, was also diagnosed with breast cancer and is a survivor for 27 years at this point. So we really are making progress, and I think we need to stay focused on that, and that makes me excited to see the change in that respect. And the other thing that I would say, and I think this has been, again, one of the great themes of the day, is that much more of a focus, I think, on the patient as a whole person, and this holistic approach to it, and with greater notions of compassion and respect. And so I think we are making good progress in that respect as well, and would hope that we'll continue to see progress both on the scientific side and also the focus on the patient as an individual.
All right, well, Charlie is a great humanist, really known for your compassion to employees at GuideWell. I'm really grateful that you shared your experience and your perspective with us here today.
Thank you, absolutely, my pleasure.
Thank you
for the time, Kate.
My pleasure. My name is Kate Warnock. Thank you so much for watching.